Hello, this is Dr. Stanley Lang, and welcome to this video. And I'd like to talk to you about a few patients' experiences to review the concept of how we can motivate ourselves or not to change our diet in a way that really radically changes our health. So I'd like to talk briefly about a few different patient experiences. Some of them you might relate to. So the first person that I like to share about is somebody that I've spoken with over many years, probably more than 20 years, and he's heard the same story multiple times. Finally, he had a heart attack, and he became a lot more serious about the story. But when I saw him in follow-up, he had still not been able to turn that corner to make the big changes in his diet, and he was still significantly overweight and still had the same risk factors that had led to the heart attack in the first place. Now, the second person is somebody that most people would look at and consider significantly impaired because he's got several psychological issues. He's a very nice fellow, but he just can't think straight because of these conditions. Yet, he was very interested in a way that he could lose weight so that he could feel better, because he just didn't have, he hurt all over the place, and he didn't have energy, and he didn't like being overweight. So I explained to him the exact same strategy as I did to the first patient. This patient, over the last 9 months, has lost 58 pounds. And he proudly showed me his new driver's license that showed that his face was probably almost a reduction of a half of this as far as the size of his face compared to what his previous driver's license. And he was very, very proud of this. Now, what's the difference between the first person and the second person? Well, even though the first person had a heart attack, and you would think that would wake you up, there was nothing connecting inside that was a big enough reason for him to give up the things he'd have to give up to achieve what the second man achieved. And that's the key, is what can we connect with inside that motivates us, not just for a day, not just for a week, but continuously for the long run. And so that strong desire that motivates us, a lot of people call a core desire. And I think that's a well apt named way to talk about a strong desire, or we might call it a heartfelt desire, something that's very strong, not just something I want. Like most people would say, I would like to have $1 million, but there's very few people that will work hard enough to get $1 million because they don't want it that much. They don't want to do what it would take to get $1 million, so they'll settle for less. So we're looking for the thing that will motivate us for the big change that will turn our life around to help prevent heart disease and diabetes. So the next person that I'd like to tell you about is somebody that just got diagnosed with diabetes. Well, he just got diagnosed with rapidly worsening diabetes. He'd known he'd been diabetic for years, but had just been sort of messing around with sort of following a diet and never really followed up with anybody. But then all of a sudden, he rapidly got worse because he was drinking more than 6 bottles of sugary pop a day, in addition to other stuff. And he was literally in the emergency room with blood sugars over 500, and now he's on insulin. Now, this person is motivated because he doesn't want to be on insulin. He wants a way to get off of insulin. And so he's got a core desire. I don't want to be on insulin. And if I can give him a roadmap that's simple and something that he can follow and feel better quickly, he will follow it because he's got this core desire. I don't want to be on insulin. Now, I saw another patient today that is a new diagnosis of diabetes just by the history. He has all the symptoms of diabetes, and I hadn't seen him for diabetes before, but when we talked today, he had all the symptoms, sent him over to the hospital, his blood sugar's in the upper 300s. He also now has a core desire. Before, he's heard the same dietary strategies that we've talked about before, this low glycemic eating plan, this eating plan that reverses insulin resistance. He's heard that before, but he's never been able to put it into action. But now he doesn't want to be on a bunch of medication to control his diabetes. And I added that all of his back pain was definitely related to the extra weight he was carrying around. So we see here a shift from somebody not having a big reason to all of a sudden they've got a big reason, and now they're going to take action that will be life-changing. Now the point I want to make is that all of us have core desires. We don't have to wait for a heart attack, and we don't have to wait to become diabetic to make big changes, because we've already got the core desires in us that will motivate us to do the big change. But we have to discover them. It can't be a desire that is like, well, I'd like to have $1 million. That's not going to be something that will motivate you, because that's not something that most people have a core desire for. But within you is something that's really important, probably several things that are very important in terms of your own health, what you want for your family, lots of different things that if you think about it, these things motivate you at a level of 10 out of 10. Not 4 out of 10. So you might have a lot of 4 out of 10 desires. That's not going to make any change in how you're doing life. But a 10 out of 10 reason, that will change everything overnight. It changes things from could be done to it's a done deal already in your own mind. So I encourage you to look for your core desires and to then keep them in front of you. It's easy to have core desires that are then put on the back burner and I don't think about them. If we have to keep these motivating core desires in front of us, that allows us to have the energy to make the big change. After a few weeks of making the big change, we then have momentum that makes it easier to keep the big change going. But if we don't keep the core desire in front of us, at about the 3-month mark, we're going to fall off the wagon because other desires are going to creep back in. So keeping the core desire in front of you, like an athlete training for the Olympics, that's the key. So I encourage you to find your core desires, put them in front of your eyes every day, think about them, don't let your mind come away from them, and whenever you're tempted to fall off the wagon, look at your core desires, think about them, feel them in your gut. Talk to somebody else about them. I wish you well. God bless and have a great day.